Have you ever heard about plague? It was a serious bacterial infection that transmitted primarily by fleas. The organism that causes plague, Yersinia pestis, lives in small rodents found most commonly in rural and semi-rural areas of Africa, Asia, and the United States. The organism is transmitted to humans who are bitten by fleas that have fed on infected rodents or by humans handling infected animals. It is also known as the Black Death during medieval times. Today, plague occurs in fewer than 5,000 people a year worldwide. It can be deadly if not treated properly with antibiotics. The most common form of plague results in swollen and tender lymph nodes in the groin, armpits, or neck. The rarest and deadliest form of plague affects the lungs and it can be spread from person to person. The symptoms of having plague is divided into three main types: bubonic, septicemic, and pneumonic, depending on which part of your body is involved. Signs and symptoms vary depending on the type of plague. Bubonic plague is the most common variety of the disease. It's named after the swollen lymph nodes that typically develop in the first week after become infected. Here are the following symptoms. Situated in the groin, armpit, or neck, about the size of a chicken egg, tender and firm to the touch. And here are the other bubonic plague signs and symptoms. Sudden onset of fever and chills, headache, fatigue or malaise, muscle aches. While the septicemic plague occurs when plague bacteria multiply in your bloodstream. Here are the following signs: fever and chills, extreme weakness, abdominal pain, diarrhea, and vomiting, bleeding from your mouth, nose, or rectum or under your skin, shock, blackening and death of tissue in your extremities, most commonly your fingers, toes, and nose. While the pneumonic plague affects the lungs, it's the least common variety of plague but the most dangerous. But it can be spread from person to person via coughing droplets. Signs and symptoms can begin with a few hours after infection of the person. Here are the following symptoms: cough with bloody mucus, difficulty breathing, nausea and vomiting, high fever, headache, weakness, and chest pain. This kind of plague progresses rapidly and may cause respiratory failure and shock within 2 days of infection. Pneumonic plague needs to be treated with antibiotics within a day after signs and symptoms first appear, or the infection is likely to be fatal. Causes that plague distribute by means of human through the bites of fleas that have been previously fed on infected animals. Here are the list of animals that brought the plague: rats, mice, squirrels, rabbits, chipmunks, and voles. The bacteria can also enter your body if a break in your skin comes into contact with an infected animal's blood. Domestic cats and dogs can become infected with plague from fleas bites. The pneumonic plague, which affects the lungs, is spread by inhaling infection droplets coughed into the air by sick animal or person. Risk factors developing plague is very low worldwide. Only a few thousand people develop plague each year. However, your plague risk can be increased depending on the area where you live and travel, your job, and your hobbies. Here are the complications of plague: death, blood clots in the tiny blood vessels, and meningitis. No effective vaccine is available, but scientists are working to develop one. Antibiotics can help prevent infection if you're at risk or have been exposed to a plague-infected person. Take the following precautions if you live or spend time in areas where plague outbreaks occur. Here are the following. Rodent-proof your home. Keep your pets free from fleas. Wear gloves. Use insect repellent. If you feel something wrong with your body, it's better go to the hospital and look for the right doctor and have a good checkup. It's better to be early than to be sorry.